If you've ever heard of kidney stones, you probably know they can be incredibly painful. But what you might not know is how doctors are fighting back with some seriously powerful laser technology. And in this explainer, we are diving deep into exactly that.
So, how in the world are we using a focused beam of light to solve such a common and, let's be honest, agonizing problem, all without resorting to major surgery? Well, let's get into it.
First things first, let's meet the villain of our story. Kidney stones are pretty much what they sound like. Tiny, hard crystals. But don't let their size fool you. Trying to pass one can cause some truly debilitating pain, which is why finding an effective treatment is so important.
Okay, so here's our game plan. We're going to start with the problem itself. Then we'll check out the high-tech laser solution. We'll ask if it's safe for everyone, weigh the pros and cons, and then wrap it all up with the final takeaway. All right, first up, let's really get to the heart of what makes kidney stones such a tough medical challenge to begin with.
You see, the goal has always been pretty clear. Get these painful things out of the body with as little invasion, discomfort, and recovery time as possible. For a long time, that meant some pretty invasive procedures, but technology has given us a much more elegant answer.
And that answer has a name that sounds like it's straight out of a sci-fi movie. Laser lithotripsy. This is really the modern, cutting-edge way to basically pulverize kidney stones.
So how does it actually work? Well, it's a pretty amazing four-step process. First, doctors guide a super thin scope through the body's natural urinary pathways to get right up to the stone. Then, they aim a tiny laser fiber. That laser then zaps the stone, breaking it into pieces so small they're basically dust. And once they're that small, they can be passed naturally, often without you even noticing.
And this really gets to the heart of it all. The whole point is to have a procedure that's not just effective, but also fast and safe so patients can get back on their feet and back to their lives with as little downtime as possible.
Now, this all sounds great, but it brings up a really crucial question. We're talking about a powerful laser here. So, who is this actually safe for? Is there like an age limit?
And you know, this is a super important question because kidney stones don't discriminate. They can affect anyone from a little kid to someone in their 90s. So, are there any restrictions?
And the answer might actually surprise you. Our sources are incredibly clear on this one. There is no strict age limit. It can be, and absolutely is, used for patients at both ends of the age spectrum whenever it's medically the right call.
So this is where it gets really interesting. It's not about the number of candles on your birthday cake at all. Instead, doctors are looking at what really matters, your overall health, how well your kidneys are working, the specifics of the stone itself, and any risks that might come with anesthesia.
And the procedure itself is incredibly adaptable. I mean, we're talking about cases where even infants have been treated. To make sure it's safe, doctors just use smaller, specialized instruments and very carefully adjust the laser's energy settings. It's a real testament to how precise this technology is.
But of course, no medical procedure is perfect, right? So to get the complete picture, we really have to do a reality check and weigh the very real benefits against the potential risks. So on the plus side, it's a home run. The targeting is incredibly precise, it's minimally invasive, there's way less discomfort, and the recovery is much faster. But on the other side of the coin, there are risks you have to consider. Things like bleeding, potential injury to the ureter, that's the tube the stone passes through, or the small chance that some tiny fragments get left behind. And this is exactly why having a detailed chat with a urologist is so critical.
Okay, so we've looked at the problem, the solution, who it's for, and the risks. Let's boil all of this down to the most important things to remember.
So here's the bottom line. This laser treatment is a top-tier, minimally invasive way to handle kidney stones. It's proven to be safe and effective for pretty much any age group. But remember, the final decision is based on a person's overall health, not just their age. And most importantly, you should always talk through the specific risks with a specialist.
And that kind of leaves us with one last big thought. This technology is a brilliant way to solve a very painful problem with incredible precision. And it just makes you wonder, right, as our tools get even smarter and even less invasive, what's the next big medical challenge that's about to be solved?